Staying in contact. I'm London Mitchell. There are many issues that affect us in Northwest Ohio, but perhaps none is more important than protecting our children. Yet, at a news conference earlier this week, Ohio Health Director Dr. Bruce Vanderhoff said thousands of incoming kindergarten-aged children are not protected against preventable diseases. He says there is a troubling drop in childhood vaccination rates. In my opinion, it is a topic we cannot ignore. So, for this installment of Staying in Contact, I have excerpts from Dr. Vanderhoff's news conference that I attended via Zoom. He could not hide the concern in his expression.
While the majority of Ohio's kids do reach kindergarten having completed all their required vaccines, we have unfortunately seen some decline in vaccine rates in the past few years, both in Ohio and across the nation. First, let's review what vaccines are required for school attendance in Ohio. For those entering kindergarten, they must have received the measles, mumps, and rubella vaccine, generally called the MMR, the DTaP vaccine, which covers diphtheria, tetanus, and pertussis, and vaccines for polio, varicella or chickenpox, and hepatitis B. Heading into seventh grade, students are then required to receive a booster vaccine covering tetanus, diphtheria, and pertussis, called the Tdap shot, as well as a meningococcal vaccine. And finally, entering 12th grade, a second meningococcal vaccine is required. Now, I mentioned the decline in vaccination rates. In 2019-2020 school year, 89.9% of the state's incoming kindergartners met all vaccine requirements. This past school year, 24-25, the percentage of kindergartners who met all requirements was down to 85.4%, or a drop of nearly 4.5% over 5 years. That means that thousands fewer incoming kindergartners are protected against the range of diseases that these vaccines prevent. Vaccines have been proven over time to be safe and effective. They're so effective, in fact, that some diseases have been determined to be eliminated in the United States. And this may cause some people to think, hey, these diseases are a thing of the past. But these diseases can be and have been reintroduced into the United States, underlining the importance of fully vaccinating your child. Indeed, there have been too many examples in recent years of vaccine-preventable illnesses reappearing in our communities. If you have any doubt about these vaccines and their continued relevance, look no further than what we saw around the country this year with measles. Nationwide, the outbreaks appear to be slowing of measles or over, but through August 19th, across the country, there had been 1,375 measles cases, and 92% of those were in individuals who were either unvaccinated or who had unknown vaccine status. Now, measles can be very serious. Nationally, we saw 173 hospitalizations and tragically, 3 deaths. In Ohio, our outbreaks are now closed, but we have had 35 cases this year, 33 of which were in unvaccinated individuals, and the other 2 people had unknown vaccine status. Thankfully, only 1 Ohioan was hospitalized and no one died. Now, I'm speaking in the past tense because the last Ohio case reported on May 20th, but clearly, measles can still afflict any of us, and in particular, those who are unvaccinated. The recommended 2 doses of MMR vaccine, though, provides 97% protection against contracting measles. Now I want to turn to HPV. Now, although they are not required vaccines for school attendance in Ohio, I want to mention two other vaccines that we encourage parents to consider for their children. One, of course, is the annual flu shot, which everyone should get this fall in advance of respiratory virus season. We usually start to see an uptick, by the way, in respiratory viruses in Ohio in the fall. The other is the HPV vaccine. Now, HPV is a common virus that infects millions of Americans. In most cases, the virus goes away by itself within 2 years of infection. But in other cases, the virus remains and can cause cancer. The CDC estimates that HPV causes more than 36,000 cases of cancer nationwide every year. The most common types of cancer associated with HPV are those of the cervix or genital areas, but it also causes certain types of head and neck cancers called oropharyngeal cancers. HPV is thought to cause 60 to 70% of oropharyngeal cancers in the United States. And these cancers are most often appearing in men over the age of 50. The good news is that the HPV vaccine is highly effective. The CDC estimates that the HPV vaccine can prevent 90% of these cancers. That is a striking statistic and the strongest evidence I can think of that parents should have their children immunized against this virus. In short, it is a powerful cancer prevention tool. And yet, according to the National Immunization Survey, nationally and in Ohio, only about 63% of 13 to 17-year-olds are in fact up to date with their HPV vaccine.
I'm London Mitchell. We are listening to excerpts from a news conference earlier this week conducted by Ohio Health Director Dr. Bruce Vanderhoff, discussing the fact that the number of fully vaccinated incoming kindergarten age students is increasing.
And now, to help us discuss these important topics further, I'd like to bring in our guest today, Dr. Amy Edwards, Medical Director of Pediatric Infection Control at Rainbow Babies and Children's Hospital. Welcome, Dr. Edwards.
Hi, thanks for having me.
Dr. Edwards, we have a lot of data to assure us that these childhood vaccines I was discussing are both safe and effective. Could you speak a little bit more to that, especially because we know there is some concern among parents about potential adverse reactions to receiving one of these vaccines?
Yeah, I really appreciate you asking that specific question because I know right now there's a rumor going around or a thought going around. I don't really know what that vaccines don't undergo safety trials. I don't know who started that. I don't know why it's spreading, but that is not true. All vaccines that are approved for use by the FDA in the United States have to go through phase one, phase two, and phase three trials. And each of these three trials has a safety component to it. Furthermore, after a vaccine has been approved for use in the United States, it has what we call post-marketing or post-approval safety monitoring. Everybody knows about VAERS, but there's actually several different safety monitoring services for vaccine safety events, not just in the United States, but countries all over the world have vaccine safety monitoring services. And so we get pre-approval safety data from phase one, phase two, and phase three trials, and we get post-marketing safety data on vaccines. The most recent study that came from Denmark was published in July. It had over 1 million children in it. There are hundreds and hundreds and hundreds of other safety studies, both pre-approval and post-approval, that all uniformly show that vaccines are very, very, very safe. Most adverse events are things like, injection, pain at the site of injection, maybe some swelling, redness, low-grade fever. Even that is not universal. Most kids don't have side effects at all. and that very significant adverse effects that might require medical attention are exceedingly rare. Some in the range of 1 to 100,000 shots, some one event per million or 100 million shots. So these vaccines are very safe, and they prevent very serious diseases.
Thank you. Let me turn now to the HPV vaccine. It's a vaccine that appears to be one that offers very clear benefits. Appears that it has a substantial impact on reducing the risk of some cancers in both boys and girls later in their lives. Can you speak a little bit more both to the benefits of the vaccine as well as to its safety profile?
Yeah, the HPV vaccine is amazing. And in fact, you had mentioned its ability to prevent cervical cancer. Australia actually has one of the highest uptake rates of the HPV vaccine, and they are actually on track to eliminate cervical cancer by 2036. Eliminate. Like, I don't think anybody was expecting that, but it's amazing the effects that they're seeing. They have a very high vaccine rate coverage in Australia. So it is very effective, especially if it's given before exposure. That's, a lot of parents are like, well, can't we defer that vaccine till my kid is a little bit older? We actually prefer to give it young because that would be before exposure. The effectiveness is as high as 97% in preventing cancer if it's given before first exposure to the virus, the human papilloma virus. And so that's actually why the CDC and the ACIP, the Advisory Committee for Immunization Practices, opted to move the recommendation for when to start vaccinating to early, usually around like 8, 9 years of age. So that if its effectiveness is phenomenal. The data from all over the world, not just in the United States. I mean, states and countries that have higher uptake of this vaccine are just watching year on year cervical cancer rates. You talked about the oropharyngeal cancer rates drop and drop and drop, which is phenomenal. But then there's the safety question, and I know in particular the HPV vaccine has gotten something of a bad rap in the safety anti-vax world. I'm not sure exactly why that is. I don't know why people are so passionate about trying to prevent people from getting the HPV vaccine. But just as any vaccine would, the HPV vaccine went through phase 1, phase 2, and phase 3 trials prior to FDA approval. All 3 of those phases included safety monitoring. And so they monitored for adverse events. And then the HPV vaccine, as all vaccines do, has gone through multiple rounds of post-approval safety monitoring. And outside of what we talked about, injection pain, redness, swelling, the only safety signal that we've seen with the HPV vaccine is same-day syncope. So syncope is when you pass out, and we do see an increase in same-day syncope with the HPV vaccine. That's actually not a unique signal. We see it with all teenage vaccines. Teenagers are more prone to passing out than other age groups of people. It's for a host of developmental reasons. But we see with vaccination, or actually with blood draw as well, that teenagers struggle with same-day syncope. So it's not a unique feature of the HPV vaccine. We see it with the meningococcal vaccine. We see it with Tdap. We see it with blood draws, that tends to increase that risk of same-day syncope. You'll hear rumors about infertility. That is not true. In fact, the data shows that the HPV vaccine improves fertility because cervical cancer can decrease fertility because of the inability to carry a pregnancy to term. So actually vaccinated girls are more likely to be able to carry a pregnancy to term because they don't get cervical cancer. And then there's another rumor, I don't know how this one got started, that the HPV vaccine has killed teenagers. That is absolutely and categorically false. There is no teenager that has died from the HPV vaccine ever anywhere in the world. I want to make that very clear. So it's a very safe vaccine, and it is very effective, and it is most effective if given before potential exposure. So we do want to make sure parents are getting that for their kids when they're still young.
Dr. Amy Edwards, along with Ohio Health Director Dr. Bruce Vanderhoff, from their news conference earlier this week. I'm London Mitchell, inviting you to join us again next week as we continue staying in contact. In the meantime, I welcome your email. Contact me through my website, londonmitchell.news.
Previous installments of Staying in Contact with London Mitchell are available on the Stream 419 app, Spotify, and londonmitchell.news.